Hello, everyone. Hello there. I just want to let you all start logging in as I see the numbers spiraling up here as we're getting ready for tonight's webinar. Well, it's tonight here in the eastern part of the United States, and where I'm located here in New Jersey on the Jersey Shore. And we've got a cold evening here tonight. Um, as it's the middle of winter. I know some of you are logging in from all over the world, and morning over in the Far East in Asia, and middle of the night in the Middle East, and in Europe, and then again we've got the people on the west coast of the United States who are finishing up their day, and it's lunchtime in Hawaii, and everybody's looking at a different view of the sky, but we're all under the same stars. And we're getting ready. I'm just seeing how things are progressing here with attendees logging in. And we'll give this another minute or so, and then we're going to get this thing started. I hope you're here for this webinar, the all-in-one composite for your restorative needs. That's what we're going to be talking about tonight or today. And we're going to spend about an hour. I will do my best to get questions answered as we go along, but if I can't or I miss it, I'm sorry, but I'll come back to it at the end. Whatever works best for you folks, or don't want to leave things out, but again, it's kind of hard to look at. I've got multiple windows open here on my screen. I've run a tri-monitor setup, so there's something on every side of me. I'm kind of engulfed in it. But we're looking good, and I guess we're going to get this thing started. So again, all-in-one composites for your restorative needs. And let's get going. All right, so I'm Marty Jablow. I'm America's Dental Technology Coach. I'm part of the Sovereign Best of Class Technology Awards. I'm one of the 5 people who helped select those awards. I'm a Dentistry Today leader in CE. I do a whole bunch of different things, but when we talk tech, it's kind of different. Everybody thinks it's going to, it's plugged into a computer or plugged into something, and not all technology right now is that. We've got a lot of different technologies that are coming, and as I call it, the future of dental technology right now is chemistry. Big into digital dentistry and digital printing, and the big thing there is resins. And we can't do everything yet with them, but that's the chemistry. And we see breakthroughs in chemistry, and those breakthroughs are really what's pushing a lot of dentistry right now. So like I say, not everything's going to beep and buzz, and not every technology, is going to have a laser or something else attached to it. But you can't fault that there's things that are moving us forward, and that's in big part is due to chemistry. So a little bit more about me. I'm a general dentist. I practice. I saw patients all day today. I'm a consultant to dental companies, and I lecture around the world and, author some articles here and there. And my office is in Woodbridge, New Jersey, and I live down the, as they call it, down the Jersey Shore. I got the Atlantic Ocean across the street, so, it's a nice place to be. But you know what? I'm no different than you. I've got a dental practice with patients in it, and I try and do my best and make sure that I can deliver the quality dentistry that these people are paying for. And with that, we have different, materials, we have different, hand pieces, everything that goes with that. But, we're all striving for the same thing, and that's the important part. You can find me. You can ask questions. Marty at dentaltechnologycoach.com is one way to get a hold of me. You can find me on, I have a blog that talks about all kinds of different dental research and different things. It's been over 10 years since that's been active. You can, follow me on Twitter or LinkedIn or YouTube or Facebook. I'll friend you. It's no problem as long as you're involved in dentistry. And, as my kids say, hey, you can even Venmo me, Dad. But that part's a joke. If you don't get that joke, ask your kids. okay, what Venmo is. But, that's really it. And, we're here to have fun tonight, and let's get going here. So big thank you goes out to Voco. They assisted me in putting this webinar together. You're going to see some cases. You're going to see some other things. Those are all mine. And again, I want to thank them for sponsoring tonight's webinar. So let's get down to composites. All right. When we're looking at composites, I mean, this is the history and timeline of composites, and they've been changing forever and ever. And they continue to change. When I first started with looking at composites, they were, if we got them to match close, people were happy. They turned yellow over time quickly, and, it wasn't the best thing in the world. But that's what we had to work with. And over time, we've had better, bonding systems. Things have changed. I mean, when I started in school, they told you, God forbid you etch the dentin. All right. Well, we finally found out that, of course, wasn't true. You can etch dentin. We now have dentin bonding systems, and which can give us bond strengths that are equal in many cases to enamel now. And we've had different types of hybrids, midfills, macrofills, nano hybrids. How much do they shrink? We don't worry about a lot of the things that we used to. Cusp deflections, mixing bonding agents. All of those things are, getting to the point where almost all companies have good ones when you think about it. There's very few that, you can't make work very easily in your office on your patients. And that's the important part to it, is that, this is a continuum, and it didn't end in 2010 here like it shows, and it's not ending in 2020. All right. Even with the stuff that we're talking about, at some point in the next few years, that stuff's going to change with giving us better properties, better ways to treat our patients. And the knowledge doesn't stop. That's really what it's about. Part of why you're here is to learn more. And that knowledge is really what's driving everything. It's driving it through all of mankind. It's going through dentistry, and we're going to talk about it a little bit more. So what are we looking for in a composite? That's always a big question. Everybody's got different things that they'll say, and they wonder what the best composite is. There is no best composite. That's the first thing. All right. There are different composites. We're going to use different things in different ways. There are some one size fits all, and we're going to talk about that. But, one size doesn't fit all. It fits many. There are going to be reasons that you might not use some of these products. There might be reasons that you do use these products, and you have to understand them. And the most important part to understanding all of this starts with the most simplest thing. And in every package, there's a set of directions. And I would really recommend that everyone, when they get a new product, please read the directions. You think you've been doing this for some of us like me for decades, and you go, well, look, I got a composite or a new bonding agent. I know how to do this. Well, no, you don't. You may not. And you have to understand what what it's going to give you, and also the limits of what it may be able to do. So, it's very, very important that you read the directions whenever you get a new product. This isn't something to be left to your assistant to then tell you. It's something for the doctor to do themselves. Educate yourself about your products, and then you're going to be able to use those products better. So, you tell me what you want. That's it. So a lot of the companies went out and they started looking and saying, what do dentists really want? What's the important thing here? What are we looking at? And, what is it that it's going to make us get what we need? That's really what it comes down to. What do we really need? And get to those answers. So here's a list of what most dentists would want from a composite. All right. We want good physical properties. We want it to be strong. We don't want, something that's weak, that's going to break under the, occlusion, those kind of things. We don't want the wear and have to come back and redo a restorations because it's worn out quickly or abraded. Low shrinkage, because we all know what happens when composite starts to shrink, and there are issues that come with that. You know, Stain resistance. Now, stain is a different discussion. In many cases, stain can be controlled, and you have to understand that. Depending on your techniques, whether you're etching, selective etching, whether you use a seventh generation single universal bonding agent, or how well you polish, all of those come into stain resistance, when you look at the margins, because that's where we're going to see breakdown the most. But, like I talked about, the old composites that I used to do at the beginning of my career, where they would just start turning yellow. That was intrinsic into the material. Or is the working time going to be enough for me to do what I need to do? We all like good radio opacity, so we can see recurrent decay, and of course they've got to be able to be polished. Polishing is a big part to this, and we want to see that luster where needed. Okay, again, depends on the teeth and the patient's dentition. But one of the things that both dentists and patients really want is those restorations to just blend in. They want to be looking at, exactly what the tooth looks like. So, here's a bunch of chameleons, or if you've ever seen the Arnold Schwarzenegger movie Predator, where the predator just blends into the background. Okay? That's what we really want. Think about it. We've been trying to achieve this, and we've tried to achieve this in many different ways, where we've tried different number of composites and layering techniques and all different things to get us to where these restorations just blend in. All right? It hasn't been easy, and it still isn't easy. Okay? Even though we're going to talk, and I'm going to show you some cases, case selection is important, skill is important, understanding color is important. All of these things come down to, what makes that restoration blend in. And that's the goal. The dentist and the patient don't want to see it. You get to it, and I'd love to be able to say the only way I can see a composite is I shine some kind of light on it. We fluoresce it, and then you can tell that there's a difference in material between that and the tooth at this point. Hopefully, eventually, you won't even see that. So everything blends in, and, nobody will be the wiser. That would be it. But again, we want to blend these restorations in so they're as invisible as possible. But, we've done different things at different times. We've all started with a Vita shade guide. All right, that's what I was taught. What color are the teeth? And we hold it up, and that's based on, how well you can distinguish color. I've gotten much better at it over the years. When I first started in my career, I wasn't so good at it, matching color of teeth. Now I'm pretty good, but, that's how we started. And then Vita came out with their, besides, they've got other shade guides besides the classic. And, then we had color matching lights. We want, what does it look like under different lighting conditions? So, we're trying to get a light that's going to, at least we can match it, with sunlight equivalent. And, so we've have different techniques like this, where we can, just look at the teeth under these lights and try and pick the right colors to make them match. Oh, and then we get to spectrophotometry. There's different devices to do that, where we can, shoot the color, and the computer starts telling us, what the best way to try and blend it all together is. We know the teeth aren't monochromatic. They've never been that way. We call them the white chiclets. All right. Those may be monochromatic, but most patients, if we're going to do some bonding on them, they don't have monochromatic teeth. Sometimes I've even taken, like my Trios, and it's got color matching built in, and we can, kind of map the tooth and try and blend everything together. And, again, there may be, here's B1s and A2s and different things, and I'll pop the Trios in just because it's simple for me, and, it's always sitting there in the op, and we can, try and do some shade matching with that. But when you really think about a tooth, and this is a spectrophotometry of a tooth, look at this. We've got 1, 2, 3, 4, 5, 6 different shades, 7 different shades or more being, shown in this tooth. And trying to reconstruct that would be extremely difficult. I mean, that's the hard part, is trying to figure all this out. What's going to make it blend? How's it going to fit into its environment so that no one sees it? That's the hard part. So then we get to what I call the shade adjustments. How are we going to build these out? Voco has, like here with their mirror fusion, you can buy different dentin colors and opacers and all of these things to try and get you to where you need to be. That's really what, the difficulty is trying to figure all these out. It's like having this big jigsaw puzzle, and only it's just color, and you're trying to figure out how these colors come together. Not just Voco, but, what about all the other composites? We've got multi-layer systems. I always say, if you're going to do this, pick one and learn how to use it well. I mean, that's really the key, is picking one system and learning to use it. I mean, years ago, I started using one system, and, it came with a million different dentin shades and opacers and stains and tints and everything in it. And I got pretty good at doing it. Okay. And then, layering, just like a tooth, when you think about it, I was taught that too, where, if you've got a complete, class 4, you build the first layer back up in an enamel shade, then you add the dentin shades into the center. And then again, all these different shades kind of blend in. So you're making like an enamel sandwich, just like a tooth would be. And we can try and do that. And you can take a lot of time to do that. And there's some people who are just real good at that. And then there's a lot of people who are adequate at that. So anything that can help make this easier, to me, would be a wonderful advancement in dentistry. So when we look at light and color, where do teeth fit in? Okay? Where does a tooth color actually fit in? We talk about Bluetooth, but that's for my headset. But where does that color fit in for teeth? And a tooth really is in the red-yellow range, all right? And the color comes intrinsically, all right? So what does that really mean? Is where's that color coming from, and how are we perceiving that color? So it's structural. The way this, it's built out, the prisms in the dentin and the enamel and everything else are what are allowing us to see this. And this is the important part, because what we're seeing is this structure actually refracts or deflects light. And, that's in combination with pigments is giving us the color. This is how we determine shades of teeth. This is how we determine what's going on with it. And, these can be very small, in these structures, which is where we get that color. And that's part of the reason it is so difficult to just match. This isn't like going to the hardware store and matching the color on the wall, where they put the you can cut a piece of sheetrock out, hand them the thing, and they can match the color almost exact. Why? Because there's only one layer to that pigment. This is pigments that are going deeper, and it's being built from the inside out. So it's real important to understand that. But there's got to be an easier way. There's got to be a way to simplify this and make it easier, so that we're not sitting there with hundreds, if not thousands of dollars worth of composite sitting in kits that we have to figure out, how to mix and match and put that jigsaw puzzle together so that we can make all of this look good. Make ourselves look good in the patient's eyes, and have the patient walking out smiling with confidence. That's the real important part to this. So we're going to talk tonight about single shade composites. All right. The one that you may have heard of the most, and which has been pushed for quite a while now, over a year. I was lucky enough to get to play with this before it was released, which is the Takayama Omnichroma. All right. This has been around for about a year. Again, probably a year and a half. And it's a wonderful single shade composite. Okay. But what most people didn't know and what Voco didn't do was push their Admira Fusion Extra as a single shade composite. Now we're going to talk about each one of these. We're going to show different cases and get into it, but they have similar properties. All right. And they get us to similar results. So again, depending on exactly what your needs are, you may choose one over the other. I have both of these. They sit in the drawer. I pick some for some things and others for others because I have to fit the material to the patient. All right. That's it, because it's not one size fits all. It's one size fits many. And you have to understand the limitations of these composites and the benefits of these composites. So the benefits of a single shade universal composite: it simplifies the shade selection. In many cases, you don't even have to take out a shade guide, all right? Because depending on the situation, this shade is immaterial because these will match a huge amount of colors of teeth. That's simple. What's it going to be? Reduces your inventory. Remember, I talked about that big tray versus composites, dentin, enamel colors, all of these different things with tints. All of it, was very expensive. And then a lot of it I didn't use all the time. So what happened? Eventually it was, expired and it went in the garbage can. So again, saving money, less waste. Very important, in running a dental practice. So let's talk about Omnichroma right now. All right, this is from Takayama. Its indications for direct anterior and posterior restorations. All right, direct bonded composite veneer. You can close diastemas with it. Got to be careful a little bit with that. And repair porcelain or composite. They come in two types. There's a regular Omnichroma and there's the Omnichroma blocker. Now, just to let you know, the Omnichroma blocker does contain bis-GMA. If that matters to you or your patient, obviously you need to be aware of that important part. All right. I use Omnichroma blocker, and we're going to show a case of a porcelain repair coming up. But one of the best places that I use this Omnichroma blocker is for the access openings in crowns. If we were doing endo through a crown, it makes it disappear. And the other place is for the access screw, if I'm doing screw retained implants. And again, placement of those makes this take minutes to get it all done. So again, knowing the benefits of one versus the other, that's kind of something that I really wanted to point out, that that makes both of those situations really, really easy by using the Omnichroma blocker. So when not to use it, all right? When you don't have tooth structure to the lingual, which again, when we start talking about diastema closure, you may have to think about it. That may be a place where you need to use both Omnichroma blocker and Omnichroma to try and get where you need, or you may need to try and layer some things before you might use some Omnichroma. Something to think about. How much tooth structure is missing? Is there going to be enough light to come through it? How is it going to reflect and refract the color? And in this case, it doesn't, all right? None of these things, and we're going to get into some of the science in a little bit, but again, the whole idea of this is not to reflect or refract light. The whole idea is to let that light pass through, so what you're seeing is the light from the tooth, not from the material itself. Extremely discolored teeth also present a problem, and, are we trying to change color in teeth? Obviously, this isn't the best product for that. So again, knowing your materials will absolutely help you choose what material may be best for any given patient. So here was an example of something I did try and didn't work, which is against everything that they wrote. All right? This guy had multiple colored teeth, big dark teeth, and I said, let me just try this for the heck of it. And so what I did was I threw a whole bunch of Omnichroma in there and look at what the result was. So guess what? I cut that all out. I redid it. It matched better, but I wanted to show this as an error And so, when you say, well, let me try it, I already did it. Don't waste your time. This is one of those ones where I hope you learn from others' mistakes. But again, I try and sometimes push the limits of some of these materials and see, what we can get and what they can do. And guess what? In this case, it failed. All right. It didn't match. I don't think it was good. I took it apart. I redid it, but you get the idea. I wanted to show this because, this is real world, folks. We're going to try something, and in this case, it didn't work. So, but here's something that did work really well. All right, this was a fracture. There was endo that had been done through this tooth in the back, and ultimately we had a porcelain fracture here, and we repaired it. All right, we were able to use. Again, picking the right thing. I used actually Takayama's universal bonding agent in this case, and we used a little bit of Omnichroma blocker and then covered it with Omnichroma, and I think we got a pretty good result in repairing porcelain there. You can kind of make out the lines, but it blended in extremely nicely. Patient walked out smiling and happy as can be, and that's the result that we're looking for. That's what we want. That's the goal. All right. This has been functioning in the mouth for, at least, let's see, 4 or 5 months at this point. All right. That I'm, no complaints. She hasn't been back to complain about it. I have seen her, but, it's functioning and it looks fine. And I think that's what we really have to remember is, how do we use these materials? How do we get the best results we can? And that became a very simple, easy repair. All right. All I did was, took a burr to it, roughened it up, put a nice, little chamfer into that porcelain, used the Takayama bonding agent, which doesn't require you to use a light. It's self-curing. And then, I layered it up and, that was it. So the question was, what's the cost of that porcelain repair? That to me was not even we can bill it out as a porcelain repair, and that's what we did. I used the same thing as the cost was a 3-surface composite, an incisal, facial, lingual, because it probably took me 10 minutes. It really wasn't a big deal because there wasn't much to it. So again, something to think about. Here's a class 4. Now, if you saw before, it didn't talk about class 4s as as an indication, but here was a small chip on a lateral incisor. It was prepped again a little bit, put a bevel on that, on that. And I would highly recommend if you're going to try and blend this all, put a slight bevel on it. And we etched it, bonding agent. In this case, I believe we probably used Optibond Universal, and, just added that right back in, all right, like it never happened, and that's the goal. I want people to look at it and go, it never happened. And again, here was another classic example of, using Omnichroma. In the past, I would have built this up. I would have used some translucent composite at the very edge, or sometimes I actually had to take a little white tint and put it in. And it was a whole bunch of steps to this. And in using these composites at this point, it just simplified what I do. But now let's get into the next one. All right. So we're going to talk about Mirror Fusion Extra. It's a single shade. It's omnichromatic, all right, similar to, Omnichroma. But there's a big difference here, all right? And this is the differences that we're really going to start talking about and why this has some properties that you may be very interested in, all right? It's a nanohybrid, okay, and we all have heard of that, but most of us haven't heard of an Ormisor, okay? Completely different thing, completely different technologies, all right? And some real benefits to that, all right? It's just plain different, okay? It's a composite, but not in the standard way you would think about it. And, that to me is really, what differentiates this product. So it's a single shade, it can be a single shade. All right. This one can give me bulk fill. All right. 4 millimeters of depth. It polishes, very easily. So does the Omnichroma. Get good luster on both. This has a very low shrinkage. It doesn't have BPA. The standard Omnichrome, again, in comparison, does not. But the blocker does. And again, this is based on their Admira Fusion, which has been out for quite a while, but it's really more ceramic. Okay, there's a lot less monomer in there, and we're going to get into that. And it doesn't matter what you use as your bonding agent. Okay, you can use the Voco, you can use the Takayama, you can use the Optibond, you can use the Clearfill, you can whatever you use. All right, pick whichever one. If you're happy with your bonding agent, you don't need another one. All right. So there's nothing special in terms of how this bonds. It's a blending of the nanohybrid technology and the Ormasurf technology. And these two are going to come together. And again, we know what a nanohybrid is. I mean, that's what most of what we're using today is. It's small nanoparticles and of glass, and how much are in there, and the fill rates and the sizes. But the monomer, okay, which we all know, and that's what gives us our smell, and that's the thing that we're, trying to evaporate when we, use our air. There's some negative properties associated with that. And, here's it's about 10 years old now. But again, what are some of those negative properties? And, they can cause allergies and stomatitis and neuropathies and irritation of mucous membranes. And where are we putting this thing? We're putting it in the mouth. So, I'll be honest, most of the composites are, again, pretty good these days. And we're not, worrying too much about this problem. But it's still, an issue for some patients who are, highly allergic. They may not do so well with, standard composite. So what the Ormasur is, okay, it's a resin matrix, but it's kind of these large molecule groupings, and they're pre-cured. So you've got a whole different way of this coming together. And what we get is better biocompatibility. Since it's kind of pre-cured beforehand, there's a lot less shrinkage. And again, we get, it's more higher ceramic content. So we would hope that, we get better longevity, and we can definitely get a nice luster on these. And, they're aesthetic, even for a bulk fill. Now, I'm a big sonic fill user. It's not the best thing to polish. Okay, and I still use it quite a bit, but I'm going to tell you, in an aesthetic situation, which I know in many cases is not the posterior teeth, but, again, we're all still trying to do the best job we can, and, there may be trade-offs, but again, what are we trying to accomplish? So when you look at it, there's the nanoparticles, there's the Ormasur matrix, and then there's the pieces of glass in there. And all of these are going to come together and get us what we need. So these are good for class 1 and class 2 posterior restorations. You can use them as a base if you wanted. They're good for class 5s. Again, I've used them in class 3s and class 4s, all right? These are important things to know, but again, depending on the size and what you're looking to accomplish, these things may change. So, we have to be, cognizant of what we're trying to do. Great for repairing things, like you said, a small chip in a veneer, enamel defects, a composite that you just maybe need to add the edge back onto, all of that stuff, that makes it very easy. And again, being that you can, the depth of cure is 4 millimeters, this is a little bit different. So again, you've got a very shallow lesion. You don't need anything but this, and it'll look beautiful, blend in, and it just makes life easier. And that's kind of the key here is, like I always say, is we want to make things easier. All right. Less steps, usually for most things, are less chances of having mistakes happen, less failures. All right. That's it. One step in many cases is better than 3 because it just presents more issues along the line. So how do they do it? They blended these technologies. We get into, how much filler and, the micro and the macro particles. And, we can see them here in this photomicrograph. But, most people, as the dentist, as the end user, this is the science. This is the stuff that, unless you're into it, I don't care what works in my hands, right? That's really the important thing. We can sit there and delve into all the science on all of this stuff and debate different things. And I've had discussions with, with the organic chemists in this and go, what do you do can we make this? And, these guys are smarter than all of us. And, there's trade-offs. Everything's a trade-off. So you have to understand that. But again, it's based on the size of everything. And, these particles really matter in terms of size, shape. All of that plays into the ability to blend. But really what happens is it's the size of the particle, all right? And the smaller the size of these particles, allows light to pass through them, all right? That's the key, is light going to pass through them. If it does, it's going to take the light from whatever next to it and show that as the color. So that's the important part. And here's an example of that. All right. These nanofillers, have an influence on the color. So when you look at this, we can see that, one I can see through, the other I can't. If you go back to the early bulk fills, most of them were very translucent. They actually, depending on the size of the restoration, they looked gray. Why? Because there was no color in them at all. All right. So if there was something dark, they would pass through. They didn't have all the qualities that we needed. But when we start looking at this stuff, it absolutely does. We want to be able to see through these composites and let them take the color for that chameleon effect, like we had shown before. But it's not just the size of the particle, okay? It's also the shapes, the spherical, how much are they, the same. So, when we look at this again under electron microscope, you can see that these small little spheres here, okay? All these little spheres, between the fillers, all right? They're going to allow that light to come through, all right? And give us the proper color and shade from what the surrounding tooth structure is. So what is the key point here? Okay, it's both size and shape that allow the particulate not to reflect or refract light. That's the important part. So it's going to take what's next to it and allow it to pass. So we're going to look at it, we're going to see it, but we're going to see what's around it as the color, not what the color of the material actually is. It's how it's coming back and what the human eye is seeing. And that's exactly what happens here. So again, a little bit, it's about these nanoparticle sizes, all right? And, size and shape, what visible light is, how much diffraction it is, and the ability to give us that chameleon effect and adapt to the color based on that size and shape. So let's get into a little bit more of the clinical stuff, not the science here. So one of the things, both with Omnichroma and with Amarifusion Extra, is when you place it on the tooth, they both look white. And I had a conversation at a meeting not too long ago where I was lecturing, and somebody said, well, I tried it and I didn't like it because it looked too white when I put it on the tooth. And I had to explain that that's exactly what it's supposed to be. So if you look at these here and here and here, what we have is it looks very white. But when you cure it, it blends right in. And that's the thing you have to take away from this, is that initially it's going to appear much lighter than the surrounding structure. But you have to know that it's going to blend once you cure it. Very, very important point. So here's just, every shade you can think of, and it blends in. All right. Now, granted, if you've got, what I call the 5 walls around it, you're going to get better blending. Why? Because you're going to see it. There's light, the color is coming from all sides, underneath and all 4 sides. When we start getting into other places, it's a little bit more difficult. But again, you have to understand the limits of this. Again, very large restorations where if you lost a cusp or on a, let's say, a maxillary, premolar, where you're trying in the aesthetic zone, this may not be the place to try and build a big thing up. You may not be able to get that color to match properly. So you may need to reach into your toolbox and pull out the right, composites for that problem. And that's the thing. Again, but I will tell you, this is a go-to in my office at this point. When we need to match something simple, I'm not pulling out a shade guy. I'm not pulling out big kits worth of colors and trying to do that. Again, picky patient, I might do that. Bigger restorations, class 4s like we showed where I screwed up, again, doesn't work. I've had other ones where it doesn't quite work the way I wanted to. But again, that's pushing the limits of these materials. So again, we want simplified shade matching. It decreases inventory, less waste because you're not throwing out a bunch of shades that you don't normally use. It does bulk fill, and it does it fairly well. In many cases, you can be one layer. In some cases, it may take two. But it's really interesting that it just flat out works, and we'll show one. Again, I've got some cases coming up here in when we're finished this part, and we'll talk about it. But with that, again, this new technology reduces shrinkage, which is really an important part of that. And again, that leads to better curing, stronger composites, those things that we're looking for. Again, there's 50. These are Voco's internals measurements. So again, I want to point that out ahead of time. But again, we look a lot less shrinkage. Now, in my world, anything below 2 is probably satisfactory. All right, but lower is the better. We know that. Less shrinkage is good. So again. But anything as far as I'm concerned, 2 or below is a good composite. So I don't want to, knock some of these composites, but again, we want to keep that number as low as possible. And again, that's based on the fact that a lot of this is with this Armature technology and it's more ceramic, it's pre-cured. So there's less monomer, there's less shrinkage, all of those things that go along with it. And that's what we need to know. And again, what about the stress? Again, we're looking at, lower shrinkage stress. These are important things. Again, we don't want, cusp deflections. And again, I think a lot of that, is kind of, beyond current technologies. A lot of this is old, some of it's technique. Again, good curing lights, making sure things cure, knowing your material. I mean, they're really important parts to it. How long should you cure? I've been using a little product now from a company called Blue Light Analytics, which is what I call it's a radiometer on steroids. It tells you for every material and bonding agent how long you should cure it. Because in many cases, as we like to say, a little is good, a little bit more is better, and a whole lot more should be a lot better. Well, that's not the case when it's curing. Heat and other things become a problem when you cure composites. So again, know your materials, know your light, know the outputs, know what's working here for you. Very, very important. It all comes down to, the science. So, with that, we've got all of these things. This is, 100% BPA free. Lower monomers mean higher biocompatibility. So again, we don't have those potential allergy reactions and things like that. Very stable bonds, again, because a lot of this has basically been pre-cured. Now, it's got a high fill rate, so we shouldn't see a lot of wear in these. It's easy to polish, and they just kind of blend in, which is the whole point. That's what we've been talking about. So again, it's just, it's one-stop shopping in many cases. This one, I liked it because this one I can use very easily in bulk fill situations. So again, it can reduce the amount of inventory in my office because I don't need to stock as much as of different composites. All right, that's really what it comes down to. So let's look at a couple of cases. All right. So these are cases I've done. If you see here, right here, that was a little bit of decay. All right. Patient was anesthetized. I use the Milestone STA machine, so it's a PDL injection. I don't use normally a rubber dam, but what we do use is either an isolite or a dry shield to isolate the teeth. We opened up the lesion, as you can see here. We see the decalcification. All right, and then we opened up the whole lesion, removed all the decay, placed a sectional matrix and the ring, and then we bulk filled this. All right, and this is what the result was. Very nice result. Again, patient's not as concerned on this molar, but again, every patient's going to be different, but I thought this was a perfect, situation to be able to take a small lesion, blend it in so nobody's ever going to see it. Here's a class 3 lesion. Now, again, that wasn't one of the original indications, but, we took out this old discolored composite that had a little bit recurrent decay associated with it. Took out the composite, placed some AdmiraFusion Extra into this, and it blended in perfectly. All right. Hard pressed to see the lesion there. Hard pressed to see the restoration there. The lesion was taken out, but hard pressed to see the restoration. And again, good result. No looking at shade, no worrying about what was going on. I mean, this wasn't very large. It did go through, so it was, again, full-blown class 3. But again, if you got enough tooth structure, it will pick up those colors, and it will allow it to blend in quite nicely. Here was an inside class 4, all right? Patient's thrilled here. Patient had a restoration there. You can kind of see a little bit of the composite still that was left over. That lesion that fracture had been repaired years ago. It had been sitting like this, and the patient just never got it repaired. This is minimal. It took no effort at all for me to get that kind of result. And we get a very nice result for this patient who no longer has a chipped front tooth and is very happy that, when they look at it in the mirror, they smile, they like it. I mean, that's what it's important. That's the important part. That's the thing that we're looking for. How well does it blend? All right, here's another class 4. Very, very thin there on the palatal portion of that. Blends right in. All right. These are simple things to do and make life very, very easy for you as the dentist. No pulling out shades, not trying to build this up in layers. This is a single layer repair. All right. All it took was me to place a nice bevel in there, etch it, bonding agent, and in this case, AdmiraFusion Extra, right in. Simple enough. Okay. Here's an occlusal that I did on this premolar. All right, there's some decay in those grooves. Took the decay out, etched it, bonding agent, and it blends right in. Again, no effort. Yes, I could have done it with sonic fill. You probably would have seen it a little bit more, but at this point, this tooth looks virgin, and that's again all about what we're striving for. All right, took out this old amalgam. All right, a little bit bigger restoration, and watched it all blend in. All right. If you want to start staining these things and putting those grooves in with a little brown stain on a, on an endo file, be my guest. My patients would, when I used to do that, would say, "Doc, why do I got that brown stain in my tooth? I want a white one." So I don't do that anymore. In a lot of cases, I still think it's amazing. I mean, people do that. Dentists do that for dentists. And, hiding things like that. My patients don't want to see it. But again, here's a perfect example of, just how easily things blend in. Now, this one's a little different. So I did this one just to show both those products in the same, photo. All right. So we had AdmiraFusion Extra on the molar and the premolar, and Omnichroma on the first molar there. Okay. All good products. They all blend in very nicely. Hard pressed to tell the difference. And like I said, they're all really good products. Difference is I can, one of the indications for the Admira Fusion Extra is it is a 4mm bulk fill. So at this point, we've been talking for about 40 minutes or 50 minutes. So anybody's got questions, now's the time to start typing them in. I will try and get to them, and we'll see where we go. So let's get any questions done, and we'll take it from there. Nobody's got a question? I like that. That means either two things. Oh, here we got one. It says, the question is, would Sonic Fill be a choice of composite for anteriors or posteriors? All right. Sonic Fill is strictly a posterior composite. It doesn't polish up to a very high luster. So again, depending on what you are doing with it, would dictate whether I would use that in an anterior situation. Then that's the real important piece. So it's really for posteriors, for class 1s and class 2s. If you've got something in the anterior where it's not going to be seen, let's say maybe an endo access opening, or something completely on the lingual, then you may be able to select one of the shades and use that. But Sonic Fill's indications are not for anterior teeth. Any other questions? Let's see what else here. Why is a rubber dam not used? It depends on the situation. Like I said, some of them I don't normally use a rubber dam, but I usually do use either a dry shield or an isolite. So I am using some kind of barrier that, to keep the things dry. Let's see. What is the bonding agent that used for the porcelain repair again, and how long have you seen these repairs last? In this case, like I said, I've got like 4 or 5 months on that repair. That was the Takayama Universal Bonding Agent. That's what I had used in that. Let's see. What else? Was sandblasting used for the porcelain repair? No, it was not. That was strictly done with a diamond burr to roughen the surface. What part is the Admira Fusion is pre-cured? What the pre-cured is that is the portion that's the filler. Okay, that's the part that's pre-cured. All right, what polishing system do you recommend? Easy and affordable. My polishing system is from Comet. That's what I've been using in my office now. Both, I don't even know what they call them. They're like little wheels with, that you use, plus some, I have some cups and points, but that's what we're using there. How do they hold up? How well do they hold up in class 5s? They hold up very well. In fact, that's where I started doing these with Omnichroma. So the most cases I have with these type of systems are about a year old. I don't want to tell you that they're older than that, because these materials I haven't been using in that way. But so far, I'm not seeing them popping off or anything. But again, that's based on preparation. That's based on bonding agents and everything else. All right, let's see what else. For the large fracture interior that did not work for you, what did you end up using? I went back and I was using, what did I use on that? I believe I got real good back in the day using Artiste, which was a Pentron product. And I still have some of that around, and we still use some of that. So I built it up with Denton and enamel and shading and the whole bit, because it was extremely dark. I do have to say, because the tooth was so dark, I got it as close as possible. There were no composites that were going to match that tooth. All right, how long have you been using the Admira Fusion? Has been enough documented case with them? So, all right, the extra I've been using for probably 6 to 9 months. Just the Admira Fusion by itself, I've been using for a couple of years on different cases, but I hadn't been using it in the same way. The Admira Fusion is a little different than the extra, but I had been using the Admira Fusion for a couple of years now. What did you use for the large class 4 when the Omnichroma failed? We just went through that. So if a porcelain crowns are chipped on the cusp, do you recommend the same type of repair as the front tooth? Yes, I do. I do recommend that the same type of repair. I mean, obviously, if you can sandblast it or do something like that, that would be helpful. But in most cases, we just roughen up with a diamond or a green stone. You may want to etch it. Again, isolate it. Use some. Again, depending on whether it's porcelain, if it's regular porcelain, you can try and repair it. But I always tell patients, these are patches. And your mileage may vary as to how long you get out of it. That kind of thing. What blocker would you use with the AmeriFusion? They do not come with a blocker. So again, you pick and choose with what you get. The radial opacity for both of these, for the Omnichrome and Fusion, I believe are both good. And did I etch the porcelain? No, I did not. With the, it's not necessarily recommended with the Takayama Universal bonding agent, so I did not, etch that. Can I use any lamp of cure? Well, that's real important. Any curing light, I always say at this point needs to be an LED with over 100 milliwatts per centimeter square of output. And as long as you've got a decent curing light, you can use that. Anything else? I think I've gotten through all the questions here. Looking back, yeah, looks about right. All right, any other questions? Type them in real quick because we're getting ready to count it down. Okay, do we have to use the same finishing and polish kits that we use for conventional composite? I would tell you yes, use whatever. You don't have to use anything special, whatever you're comfortable with, whatever you've got in your office, use that to polish these. They both polish up extremely well. You'll be very happy with that. So again, any other questions? We got more questions coming in now. The flowable, I get gray streaks when adding it over it as such when doing chairside veneering. Again, using the right material. I don't use the AmeriFusion flowable. I don't use many flowables at all at this point in my practice for various reasons. But I mean, in most cases, unless I've got a very small restoration, I'm not a big flowable fan. Those gray streaks, again, could be from the material, could be, beveling, could be a whole bunch of other things. Can use a different brand A2 composite as a blocker. Yeah, this stuff will match with anything you got. So if you've got something else that's going to block it, some kind of, composite that's opaque, go ahead and try it. But just remember, if you've got something that's real white, this may pass through that white. And so you got to be, again, try and make sure that, what you're doing, you may want to try it beforehand, cure a little bit and then, put it over it and see what it looks like. But, again, you're going to have to figure out once you start trying to use blockers, it means you're trying to cover something up. And the best way to do that is, is understanding the materials. The cost difference between the Omnichrome and the AmeriFusion Extra, I couldn't tell you. All right. You're going to have to look that up with your rep because one, I don't do the ordering in my office. I tell them what I want and they just doing. What curing light do you prefer? There's lots of good curing lights out there that I think you can look at. I happen to use in my office, I use Kerr's Demi Plus. Those are good curing lights. As a we usually, as part of Celerin Best of Class, we've selected the Voco, not the Voco, the Ultradent. Now I'm drawing a blank. The Ultradent curing light. Many times. So that's another good curing light. Most of these curing lights are good. The only, for normal restorations, 2 to 4 millimeters in depth. When you start getting beyond that, you may see differences and you may want to go check, if you're doing lots of deep, bulk fills, that's a different thing where your curing light matters. Again, knowing the directions. An example with Sonic Fill, 10-second cure from the occlusal, 10-second cures from both the buccal and the lingual. You have to understand your materials and what the instructions say when you're looking to cure these. So we're right up at the end. I want to thank everybody for joining in tonight. Wherever you are in the world, make it a good evening, a good day, and a good tomorrow. So again, thanks for joining me, Marty Jablow. If you need to get a hold of me, you know how to do it. And thanks again for tuning in. Bye now.